Imagine this. You wake up at 2 a.m. drenched in sweat, staring at the ceiling, frustrated because sleep just won't come back. You check your phone 3 a.m., 4 a.m., and before you know it, your alarm is blaring. You wake up feeling exhausted before the day has even started. Menopause is wrecking your sleep, and if you're wondering why, and more importantly, how to fix it, then you're listening to the right video. I'll also be telling you about one everyday habit that could be making your menopausal insomnia even worse. At the end of the video, I'll also offer you a free sleep guide to help improve your sleep quality. Hi, my name is Dr. A and I'm a lifestyle psychiatrist. If you're in your 40s or 50s and suddenly struggling with sleep, it could be your hormones. According to the National Sleep Foundation, up to 60% of menopausal women experience insomnia. And it's because menopause flips your internal sleep switch upside down. Do you know the story of Thomas Edison and the light bulb? Before he succeeded, he failed over 1,000 times. When asked about it, he famously said, "I haven't failed. I've just found 1,000 ways that won't work." Many of my patients feel the same way about sleep during menopause. They've tried countless methods without success. But here's what's fascinating. Just like Edison eventually found the right combination for the light bulb, there is a specific combination of strategies that can help you sleep better during menopause. And this is important because poor sleep isn't just about feeling tired. Research from the Journal of Sleep Medicine shows that chronic sleep deprivation during menopause can increase your risk of depression by 40%, double your chances of developing cognitive problems, raise your risk of cardiovascular issues by 30%. Before we talk about just how you can fix it, here are 3 reasons your sleep is affected during menopause. Number 1, it's like your hormones are playing tug of war. Estrogen and progesterone, your sleep-protecting hormones, plummet during menopause. Estrogen regulates serotonin and melatonin, the chemical that helps you fall asleep. Progesterone has a calming, sedative effect. Without it, you might feel wired and anxious at night. Number 2, hot flashes and night sweats hijack your sleep. About 61% of menopausal women experience sleep disruptions from hot flashes and night sweats. This causes abrupt awakenings and difficulty falling back asleep. So if you've ever woken up drenched like you ran a marathon in your pajamas, you're not alone. During menopause, your brain may overreact to temperature changes because when estrogen drops, your brain gets confused, thinking you're overheating even when you're not. The result is that your body cools itself by drenching you in sweat, waking you up multiple times at night. Number 3, your cortisol levels are elevated. Studies show that decreased estrogen during menopause can contribute to elevated levels of cortisol, your stress hormone. Increased cortisol means your brain stays on high alert instead of winding down for sleep. This makes it harder to fall asleep and easier to wake up at 3 a.m. with racing thoughts. In general, sleep issues during menopause are due to a combination of hormonal, physical, and psychological factors. In addition to the above, conditions like restless leg syndrome, obstructive sleep apnea, nighttime urination, and joint pain can compound sleep issues. Other complicating factors include ongoing mental issues like anxiety and depression, as well as midlife stressors like career demands, aging parents, caregiving, and financial matters. So how do you fix your sleep struggles? Think of your sleep like a phone with outdated software. Before menopause, everything ran smoothly, just like when your phone was brand new. But then menopause hits, kind of like a major software update, and suddenly the old settings don't work anymore. You wouldn't keep using a slow, glitchy phone, right? You'd update it, tweak the settings, and maybe even get a few new apps to make it work better. Well, your sleep needs an upgrade too. Let's talk about 5 ways you can optimize it for this new phase of life. Number 1, control your blood sugar levels. Have you ever woken up hungry at 3 a.m.? That's because low blood sugar triggers cortisol, waking you up. Focus on nutrient-dense foods with complex carbohydrates and fiber. These keep you full for long and avoid blood sugar spikes. If you must have late-night snacks, consider a handful of walnuts or pumpkin seeds, which boost melatonin. Also, avoid alcohol at night as it disrupts REM sleep, making your nights even worse. Number 2, block the blue light. Seriously, this one works. You see, phones, computers, and TV screens trick your brain into thinking it's daytime, blocking melatonin and keeping you awake. One everyday habit that could be making your menopausal insomnia even worse is phone scrolling at night before bedtime. To help with this, consider blue light blocking glasses 2 hours before bed. Switch your phone to night mode, or better yet, leave it outside the bedroom. Read a book instead of checking emails at night. These can help maintain natural melatonin levels, improving sleep onset and quality. Number 3, reset your sleep clock with morning sunlight. Menopause messes up your circadian rhythm, your body's internal clock. 15 minutes of morning sunlight within an hour of waking up can help with this. Getting some morning sun helps your brain regulate melatonin naturally, making it easier to fall asleep at night. This can reduce menopause-related depression by up to 40%. Number 4, use the 4-7-8 breathing technique. It's based on ancient pranayama practices, but backed by modern science. Studies show that it can reduce sleep onset time by up to 50%. So if you're still up in the wee hours of the morning, don't scroll on your phone. Instead, breathe in for 4 seconds, hold for 7 seconds, and exhale for 8 seconds. Repeat until you drift off. This slows your heart rate, calms your nervous system, and tells your brain it's time to sleep. Number 5, cool your core body temperature. You see, your body temperature naturally needs to drop by about 1 to 2 degrees Fahrenheit to initiate and maintain quality sleep. During menopause, hormonal changes can disrupt temperature regulation, making it harder to achieve this natural cooling effect. Some evidence-based strategies to help cool core body temperature before bed include keeping your bedroom cool around 65 to 68 degrees Fahrenheit, taking a warm bath or shower 1 to 2 hours before bed. This paradoxically helps your body cool down afterward. Using breathable bedding materials, avoiding intense exercise close to bedtime, and using a fan to prevent overheating. You can download my free sleep blueprint from the description below. So now you know why menopause is wrecking your sleep and exactly how to fix it. But did you know that what you eat before bed can make or break your sleep quality? I cover the best and worst food for sleep in my next video. Click here to watch.